Amy. Welcome, Amy Eicher. That's right. Hello.
Hello.
Where are you? Where are you? What's going on where you are? How are you?
Yes, I am in a beautiful little town in central Illinois called Normal.
Well, you're known as Restoring Venus. You're an author, educator, pain coach, all related to chronic pain.
Yes.
And so you had an experience with pain. It started when you were 18 and you began learning, coaching, educating. Do you want to tell us how your path transpired?
It's a twisted story in a lot of ways, but I got hurt when I was 18 swimming. But my coaches said I was an Olympic hopeful, and they said if you just put in a little bit more time, like aim, you could go to Olympic trials. So I was good and I was fast and I had a lot of potential. And about 3 months into the season, I got hurt, and it was bad. It was bad. I mean, this was very scary and disturbing pain, and it was my low back and buttocks, like. It's that area where you don't really know if it's your back or your butt or your hip.
Yeah.
Like, and I know a lot of people have trouble describing that. We generally just tend to point or circle things on pictures because it's just easier.
Yeah.
It's there. It hurts there. And at times it felt burning. At times it felt stabbing. At times it felt like bone pain. Over 20 years, it kind of felt like everything. Yeah. But the main complaint at the time was like somebody had shoved a screwdriver in there and was kind of like jimmying it. All of the blood tests said nothing was wrong with me. So after about 3 months of testing, they went, well, I guess you just don't want to swim, and this is your way of telling us that.
Right.
And I was like, well, that seems crazy. It pays for my schooling. It pays for my housing. It pays for my meals. It's where all of my friends are.
And I get really good at it.
Like it's in my veins. Like
I relate to this with my artwork. And I had to stop. There were years where I can draw Theo, I can sketch Theo in a couple of minutes, and I couldn't do anything. I totally relate with what you're saying. Yeah. There's no way your brain would stop you or your body would stop you from going, yeah, I get, yeah.
Right. And to be told that my core just isn't strong enough. And I'm like, well, how strong does it need to be? If I can hold a 2 and 3 minute plank, and I can do a bajillion sit-ups.
Yeah.
What are we talking about here that's not strong enough to hold my pelvis in place? Like what? Okay, you're the boss.
Well, I kept hearing about core strength. And I did yoga. I had done yoga for years. But you hear it, don't you? You hear it. So what did you do?
Well, so I believed them. So I did the PT that they told me, and I did the pelvic adjustments that they told me, and I did all the things because they said no more swimming. Swimming would be bad for your pelvis. Just this past summer, I did have a chance to get together with the trainer that had helped me 20 some odd years ago.
Yeah.
And I said, John, why did you not put me back in the water? Why did we not put the fish back in the water?
Yeah.
And he was like, Amy, we did so many things wrong with you.
At least you heard that, because that's good closure, isn't it?
It really was. Well, and I had given him Restoring Venus, my book, which he has mentioned positively in as like the first person that actually believes that I'm telling the truth.
A video chat with my diagnosing physiotherapist. She's fantastic. She said one of the first things I do is just put people straight into the water. I want them in the water. It's interesting that you said that.
Right.
How did you weave out of pain and end up educating and coaching and obviously using the experience to help others?
I'm a learner. I love to learn. Yeah. So I did finish college. I got a degree in education and I taught for a little bit. I went from that into full-time youth ministry and went on and got my Master of Arts in Religion, which is really like a lot of psychology.
Wow.
A lot of reasoning. I mean, traditional psych. So because my specialty was youth ministry, I took adolescent psych, developmental psych, abnormal psych,
wow.
And then I had all the philosophy classes that were dealing with Christianity. I had studied world religions as a senior in high school.
Wow.
Just because it fascinated me, and I wanted to know, okay, so if I'm going to believe this stuff as a Christian, what differentiates it from the rest of the things out there in the world?
But that's people. You need to understand people. That's it. That's people.
working in the religious community is people. And I don't, just to note, I don't like calling it the religious community because I work with faith. Yeah. Do you really believe this? What do you believe with this? What's the context of it? What's the historical context? What's the social context? What's the context now? And I loved those discussions. So that's happening in the background as I'm traveling this pain road, right? Because it's 20 years long. I mean, we don't want to talk about that for 20 years. It's a long road. There were ups and downs. I wanted to die. I didn't kill myself because I'm clearly here on this chat. And I say that glibly, but the reality is there were multiple points along the journey where I just couldn't take it anymore. And I wasn't getting real help. There were a couple key people along the way that suggested maybe this was beyond a tissue issue and I needed to look at that. Okay. But what I heard was, it's in your head and you're making it up.
Yes, yeah. Yeah.
So I wasn't in a place where I was really ready to receive that.
Yeah, we're a bit of a generation, aren't we? That there's going to be a generation that comes out, opioid, it's in your head. Opioid, it's in your head. It's a generation, isn't it? And hopefully we're moving on.
And so what ended up happening was I had surgery because I felt like it was the only thing left available to me. 2 years after my surgery, I was still hurting. I was more mobile, but I was still hurting. I was in PTA school because I was at least convinced enough that I was going to be able to have a part-time job.
Yeah.
And I was asking questions and the answers coming back from my professors were not satisfying as that. And I was like, okay, but what about Lorimer and Mosley? Like, what about Nowie out in Australia? What about the NICE guidelines for back pain in the UK? What about? Yeah. And they were like, that's outside the scope of this class. And I was like, no, don't do the hand thing at me. And so when I realized the learner in me was not going to get more of the answers that I needed, I started seeking out other sources. And that's when I found San Diego Pain Summit and all of the wonderful people involved in that. Yeah. And I found Bronnie Lennox Thompson from New Zealand. These people that have all of these thoughts and share them on Facebook and blogs and books. And I just started consuming.
You love people and you love learning and you've got the pain. You know, so I'm starting to see what's going on here. We're just to learn more about how and what you're doing, and we'll come back to it again at the end. But Restoring Venus is a website.
Restoringvenus.com is my website, and you will find blog posts from the last 3 years on all things SI, pain, and emotion. And as a storyteller, most of those blog posts are full of a little bit of my story so that you know you're not alone. Yeah. And then data. Like I try to break down, because research, nobody wants to read research papers when they're in pain.
Well, you can't understand it either. It's not patient language, person language. It's really not. Yeah.
Like I think one of the pieces of information that has stuck with me was that it can take 25 to 50 years for current research to find its way into schools and clinics.
Well, this is interesting because yesterday I did a second presentation, that core skill thing. And it was interesting to hear the facilitator say, look, we trained this way, but that's wrong now. And we've got to go this way. And you just think, wow, these people are in the middle of their careers and suddenly, but you're right.
This is the formation of Restoring Venus, right? Because I'm coming out of my story and I've accidentally found pacing, and I've accidentally found graded exposure, and I've accidentally found returning to things that I love. Yeah. And like, I basically didn't listen to my physical therapist and started swimming more than he thought I should. And you know what? It was okay. And I trusted myself. Like I didn't go nuts. Like, I don't know. I'm learning that there are concepts and processes that go with all this stuff that I've been stumbling and accidentally finding my way through. Yeah. And then I fell into a little bit of understanding cognitive behavioral therapy, and I was like, oh, I get it. Like, and then that's when I started putting together that this overwhelming fear that I felt at trying anything new was actually like a thing. Again, not in my head, but it was elevating my nervous system, which was giving me less room for error. Yeah. Like my body was going to respond to these things. And when I started understanding that, then I started doing things like the journaling and the meditation and the breathing and all the things that to an elite athlete felt like foof.
Yeah.
Right?
But so effective.
So I went back to school, got the PTA, worked for 2.5 years, and was so frustrated by the messages patients were getting, especially chronic pain patients from my supervising PTs. And I started to see that way was not going to fit real well in the way that physical therapy in my particular community is structured.
Years ago, I went back to my GP to say, opioids are not my long-term plan. It's not going to work.
It's not my long-term solution.
Yeah, and she looked at me as if, this is a bit frightful. Fair enough, maybe they don't work. We work through it together. But I just thought you can't be doing this to people and then they need more and more and more and more and more. It just didn't sound right to me. Of course, you're on the ground doing the work, but yeah, by the time that makes its way into a journal, into a medical study, and then it's finalized and ticked, and then in the book and then in the hands, it's just way timeline and the slowness, trying to build pain train and change behavior. I'm seeing how slow things go in the medical field. But when you look at the internet, I mean, look what it's done, even just here. Look what it's done in the way that a patient communicates with a professional. And so that's moving, and that's moving at a really fast pace.
At a very rapid.
And the medical profession is sort of, there's got to be a way to fast track that too. But of course, we've got to remember too how busy they are.
Listening to this, please don't blame your provider for not knowing. They really are doing the best they can with what they have.
Yep, I think that's really important. I mean, I hear all the blame. It's hard because you sort of want to get well and no one's helping you get well. That you feel like no one's helping you get well. And so
like everybody can get the exercises and the body movement things from a physical therapist. You can get the touch from a massage therapist. Yes. But the part you couldn't get was picking through your story. They couldn't help you find the bits that you needed. Yeah. But it turned out I was very, very good at that.
Well, you knew people.
And I love people, and I love stories, and I love your story. Like I want to know about the person that I'm working with. The thing that I say and I type the most is your story matters.
Yeah. Yeah.
In whatever form that it takes and however you choose to tell it, your pain journey matters.
Yeah. Chronic pain, as any patient, you go to your provider and you sit there and they have the answers. Well, chronic pain is different. Somebody with chronic pain has to pave their way. Whereas usually if you have something wrong with your heart or your eyes, you sort of get the referral to the specialist and there's this path of treatment, and it might be an op, it might be whatever it is, but there's a path there. We don't have a path. And in actual fact, when we make our path, we're making it firstly by figuring out what doesn't work. It's so backward. It takes so long to get to that thing that works, and so okay, that doesn't work. That doesn't work. That doesn't work. Oh, this might work. It takes a whole pathway so backwards. It's really, really very difficult.
We've laid our entire futures in the medical community's hands. And guys, the medical community is not equipped. Chronic pain is self-management and self-discovery. Getting to a life that is bigger than what you are living now is about owning your story. It's about you figuring out what works for you. Now, a knowledgeable person should be giving you options so you can check boxes and be like, did that, didn't try this, did that, right? Yeah. It's medical management. Medical management is part of moving beyond your pain. So don't think that, surgeries and injections and medications don't apply, because they do. Yeah. But there are so many components. Like I have 6 of them that I think everybody needs to peek at. And so the pillar of my working with people is that there is your story, and there are so many things involved in your story. So being able to tell it and not being interrupted as you tell the whole thing, right? There's the science. Dealing with flares. Do you have a plan? Are you prepared? Learning to move again, because the way that we often do it in PT and the way that we do it ourselves generally just tends to lead to more pain. So there's rules, so to speak. And they're the same rules for everybody, but the way that we apply them is slightly different.
Yeah.
And then the last two are thoughts matter and how to identify thoughts that are not helping us in our recovery. And the last thing is, what is your connection to the world and what is your purpose? Because we've given that up in the quest for solutions to our chronic pain. And those 6 pillars are what I help my clients look at and figure out where's, you got stuck in your story somewhere. So let's figure out where you got stuck, because I want to see you for the shortest amount of time possible to get you the biggest results possible so that you don't need me ever again.
Accept it's complex, and then you've got to you need this empowerment and this motivation. So important to, and that's again a pain train. That's what it's about. It's about me walking in with my portfolio, with my story. And I've got a profession, I've got a career, or whatever it is, and I have this story, and I own that. So when I moved from the city to country town and had to find a new GP, I realized then that I didn't own my information. I had been seeing my GP since I was 17. So can you imagine going to a GP with chronic pain? You've got to see her now. She's going to be your doctor, and you've got 9 years to explain. That is, the thought of that trauma, 3 appointments before you could even get to the pain management.
Right. Well, and the trauma of retelling our stories in those appointments is very real, and it kicks changes are happening in our brain when that happens. The reality is we think in the part that's called the prefrontal cortex, and that's where we get to make all kinds of great decisions. Pain does the same thing. It kicks us into the part of our brain that processes emotion more than detailed thought, right? So we're in the middle of this appointment where we're supposed to be asking questions, being super efficient, telling our stories, but internally what's happening is it's a re-trauma. It's a re-trauma event. And we get kicked into that fear emotion place, whether we're angry because doctors haven't helped us, or we feel weak, or we feel small, or we feel, right? I've used too much services, whatever your particular flavor is when you walk into your appointment. Not having to do that because you can send them your records through Pain Train, brilliant.
I get in there and Nick says to me, right, let's get through this list. And I walk out and it's like, oh my God, that feels amazing. I have all my answers. I have everything that I needed to know. It was so great. But back to you.
Well, I was going to say, the way I deal with that is I record our sessions. So all of my sessions are through Zoom, just like this. And so I just hit the record button and I say, don't worry about writing stuff down. We'll just chat and get your stuff answered. And then if you want to go back and listen again.
Fantastic.
I basically try to treat my clients like I wish providers had treated me. Yes, I'm the professional and I'm going to tell you how many sessions I think you need. But you know what? I don't know your finances. I don't know your time. I don't know your energy. I don't know your tolerance. And so you've got to help me with that. You're feeling super amped up and you want to see me once a week. Okay, we can do that. You want to see me twice a week? We can do that. I just, as a standard, I tend to say, let's try once a week for 4 weeks, and monetarily and question wise, let's look at what kind of time you need. And go from there.
Going. It's a process, isn't it? How is it going from one chat to the other way? And there are so many rules when communicating pain. You hear about, this is the right thing to say, this is the wrong thing to say. Don't say my pain. You should never own it. There's a lot of caution, and that's, then that's fear, but you're so front and center. There's this fearlessness and confidence in your address. Is that what people living with pain need? I mean, when I hear you speak, your tone tells me that pain isn't the end of the world. I mean, I like that.
I like that that's what you hear. I want everybody to know that I can't necessarily take away your pain, but I know that I can help you live a bigger, more fulfilling life.
Yeah.
And that pain doesn't have to rob you of everything. And I don't think anybody's saying that. I do think fear is a gigantic driver in our pain. I think it's accidentally driven in our medical community because, quite frankly, in marketing, they tell you fear sells. And I don't like that. Like, I think hope should sell.
Yeah.
I think hope should sell. And I think reality should sell. And the reality is pain sucks.
Honesty. Yeah. That's the thing. We've sort of been faffing around about pain and, you know, pop the pill and off you go. Some people like nerve pain is so doesn't really fit into that mechanical message.
And I think the crazy thing is when we're talking about mechanical pain, we're really talking about acute pain. We're not talking about chronic pain. But we have so many messages about fear and do it this way and don't do it that way. And like, from the things that hurt you are your posture, your structure, and your biology, right? Don't bend over unless you hinge at the hip. Don't cross your legs because it's bad for your sciatica, to our nervous system. Yeah. If pain is about threat to the body or the existential body, if you will, keeping that list of do's and don'ts so tightly held, it's never gonna lower that. Doesn't matter.
Yeah.
And you can't enjoy the things that you enjoy because you're constantly worrying, which is blowing out all of the nerves in your brain going, oh dear God, this is super dangerous, even when it's not. And we need permission to play and explore. And a lot of that is because of what society says we're supposed to do with pain and what we say to ourselves about pain, what our friends and family say about pain. Like, there's so many things to wade through to get to the heart of why does this individual hold on to all of these things.
Point, that spot where you identify, hang on a minute, I've got you, that bit right there, we're gonna tweak that bit and it's gonna make a massive difference to you. How do you know, I know you listen to the story, but then what happens?
It's a lot easier for me to help you if you're honest, and that is challenging for clients. Like, you really do have to be in a place of readiness by the time you're willing to hire a pain coach, right? You've been through some stuff.
Yeah.
And there really is this belief that they don't like everybody else has tossed them aside and they're not worthy of being better.
We are generally all, you know, made the same, but our recovery, our experience is unique. So you're stumbling on fear, you're stumbling on lack of confidence, lack of resources and education. So there's a lot of I feel unpacking. I was going to say unpacking. I feel like I've been unpacking a load, you know, for nearly 14 years now. Listening. So listening, because very often in that first consult, if someone is given the ability to tell their whole story, they'll tell you what hurt them. They'll tell you the things that they believe that you can go, ooh, but science says. They will tell you what they are missing in their lives. And they'll probably also tell you, you know, like they'll tell you about their personality so you can figure out, are you a type B that is just completely given up and you're not moving and you need a little, like you need to learn to get up from your desk and move every 30 minutes. I don't care if it pisses your employer off. This is what you need to do for you, right? So when I say you need to learn to love and take care of yourself, that comes with very practical implications for each person, right? If you're a mom of 7 and you can't go to the bathroom alone, how are you actually taking care of yourself? If you don't have that minute.
Right? Like, so let's come up with strategies to create time so that you can actually have a thought.
I relate to that because when sometimes Theo will call me out into the gallery because someone's there to say hello. And if that conversation is really long, as in long for me is, you know, 15, 20 minutes, if there's a real, I just have to come back and just I need the silence, and I need this calm and stop. Caught up. If I'm on the way back into my studio, and someone else walks in, and then there's another 15 minutes, or I just start, I can feel the pain levels go up and up and up. And of course, the end of the day is going to be more difficult, and then the next day is more difficult.
And so the thing is, for me, somebody, taking 15-20 minutes of my time and then popping into the gallery, I'm going to be juiced and ready to go.
Yeah,
I'm not going to need that alone time. And I think for a lot of people, it's learning that your way is okay and my way is okay, and neither one of us is wrong or needs to change.
I love it. I absolutely love
but
it.
Do you feel like on your journey about learning to accommodate or adapt or self-manage, we can use all of those terms, do you feel like it took a bit to understand that portion of you so that you could feed it?
Absolutely, because at the start, I mean, my first 4.5 years was this incline, this going up. This pain was getting worse and worse and worse because I was undiagnosed. I didn't have time. I never got that time and that headspace. It was always just full with pain, always full. I didn't actually, when I was still, if I wasn't asleep, the pain levels were soaring. It was almost like they would surface. And become louder and louder. So if I wasn't sort of trying to distract myself, I really had to be asleep because it was unbearable.
It was unbearable.
But coming out of that and realizing calm, quiet, so just sensory calm, sensory, just turn down that volume. Yeah, that was key, really key. And of course, from there, you turn it right down, and you start to build from there. So I'm saying 15 minutes now. I couldn't do 5 when we started the gallery 5 years ago. Right. So,
and you've built capacity.
Yeah.
You've built capacity for that, and you've built in strategy to protect you. Because
it took a long time for me to learn that I was driving and that I knew what was best. My physio kept saying, you're doing it. You're making the changes. You chose to have an implant instead of stay on the medication. You're choosing those things.
You're choosing.
Yeah, it really takes a long time to get your head around the fact that, yes, you went to the provider and they said, well, okay, here are all these things that you can try. And you went, I think that one. Or after you tried something, you went, okay, I'll stick with this. No, you can take that one back. You're making you're making those decisions. You really are. But it does take a long time, and it's not what we're trained to do. We are trained to be passive, to go into the provider and just, thank you, can I have all my information? I'm going to go home and get better now. Bye.
The essence of working with me is I'm going to help you take all of that back.
Yeah.
Because it's your life. So if you want to live on the couch, that's fine.
Yeah.
But if you want more,
yeah.
Like if you want a little bit more, that's also fine.
Yeah.
If you want a lot more,
yeah,
that's also fine.
Yeah.
Right? But when I asked my group that I've been with for 5 weeks, like, how would you describe the essence of Amy? The thing that I said was the endless quest for learning. That I really do think that informs everything I do, because I can't and I don't want to stop learning. So I'm always going to bring to you what I know.
Questions.
But they said that my empathy really helps them to be vulnerable and to explore their own stories. So and that because they are able to share the fact that I've been through so much, the understanding that I bring. So the knowledge plus the understanding. They said they've never experienced support like that before.
That's great.
And I agree with them. But I would say the other thing that I bring in probably obnoxious amounts is belief that you can reach your goals.
Yeah.
So right now I'm running a 5-month group called Moving Beyond Chronic Pain.
Yeah, I saw some of those your workshops. I was going to ask how they work, what's the structure. Yeah.
I will be happy to share that. We're in week 5 of that program. It'll be opening up again March 8th. I'm having another workshop.
Okay.
In my Facebook group. We'll make sure you have all that information. But if anything I've said today piques your interest, sign up for the workshop. It's totally free. Yeah. And then the next group will open for Moving Beyond Chronic Pain.
We don't know a lot about pain. I honestly feel with all the things that I've been through the learning, through contacting all the professionals, through trying to catch up with the research and putting it all on Pudendal Nerve, trying to make this resource valid. I honestly, a lot of the days, I just think the more we learn, the less we know. That's how it feels. And of course, you read the research, and I'm quickly hurrying to get to the end of the, sort of the end section, going, right, this is going to have the answer. It's never there. It's
no, because there's always the next question.
Yeah. Always more questions.
True. And so I'm still growing. I'm still learning, hearing other people's stories and going, I think that's also part of mine.
Yeah. Wow. How we connect like that. Yeah.
So I teach, as a teacher, I learn from my students as well.
Yeah. And that's such an important thing. I think hearing other people's stories in some ways are more powerful than reading the research or hearing from your professional sometimes, because you're going to say, I would say something, I feel like I've got my finger stuck in a PowerPoint, and someone's going to say, well, I feel the same way, and you know what I do about that? And off they go. And before you know it, because people want to help people, and the Facebook groups and the WhatsApp groups or whatever group that you want to be in, really there's just so much benefit to that, so much benefit to connecting through personal experience.
Absolutely. And what's my favorite part of coaching?
Yeah, what's that bit after you sort of see the essence, you've established that connection, and what's that bit? What's the bit that show that you just go, oh.
It's that Facebook message that comes, and it usually starts, I just had a revelation, or I just had an aha moment. Like, so you got the information, you've had some time to stew on it, and like all of a sudden everything just went click. And when they have those moments, like, I literally can't stop smiling. Like, it's so much fun when people put stuff together. So my favorite quote when I was in undergrad, learning to be a teacher, was, the whole art of teaching is simply awakening young minds for the purpose of satisfying it afterward.
Yeah, that's lovely.
Anatole France. And to this day, I still love it. I love that my job is to simply open your mind so that you can figure it out.
It's like the empowerment, because that's what makes the difference. Getting understanding what it is that what's outlined and what's ahead, and empowering someone so that they go ahead and do it,
and it's the doing, right? So like, I love that first moment where all the information makes sense, but then when they take that and they turn that into action.
Great.
I'm like a proud parent. I mean,
it's like, I didn't live all of that for nothing, that pain, every moment of it. That's the other thing. You really want to make something of it, because otherwise it's a total waste of life.
And writing Restoring Venus, like, that was a labor of love. That was emotion intensive. And I did it because I did it for a lot of reasons, but the main reason was I knew from being on Facebook for 10 years that there were things people were saying in the privacy of patient groups that people without pain needed to hear.
Yeah.
And people thinking those things needed to hear they weren't alone. We're not alone.
No. And that's exactly what you feel when you have chronic pain. You feel aloneness, and it's endless. It goes on and on. You just feel like no one gets it. I'm by myself in this. No one's going to be able to help me.
Yep. Yeah. Even the people that love me can't help me because they can't understand.
Yeah. Oh, yeah. My goodness. I just did an interview with Theo, the carer perspective. You've got to believe. And it's hard sometimes, because all you're saying is, sorry, I can't do that. I can't do that. I can't go there. I can't do that. This has been fantastic, wonderful, empowering, positive, inspiring, motivating. Thank you so much for the chat. I'm sure there'll be a reason for us to talk again later on.
We're going to need you to pop over to the Facebook group and tell us all about pain trains. So we're going to at least have to do that.
Very happy to. Well, look, it ties in with everything you talk about with stories, personal stories, and coming along and empowering people to really just grab their backpack and their story, and to keep it close, and to really manage and get heard.
But thank you so much for giving me an opportunity to talk about my passion and to talk about coaching. And the easiest place to find me is restoringvenus.com. And if not, just type Amy Bush Eicher into Facebook and you'll find me somewhere.
Because it's your time over there. And I'm having
it's
I'm
evening
having
here. So.
Morning. Evening.